Chancellor of the University of the West Indies, Sir George Lane, Vice-Chancellor of the University of the West Indies, Professor Nigel E. Harris, Pro-Vice-Chancellor Clement Sankat, St. Augustine Campus Principal, and Dr. Rohani Miraj Sankat, members of the Executive Management of the University of the West Indies, Honorable Speaker of the House, Wade Mark, members of St. Augustine Campus Management, Public Orator, Professor Suraj Paul Tilak Singh, faculty of the St. Augustine Campus, benefactors of the University of the West Indies, parents, friends, well-wishers, members of the media, my fellow graduates, good afternoon. My fellow graduates, here we are at a destination which, for the past 4 or 5 years, seemed eternal, seemed a distant dream. We are not only here to acknowledge the actualization of that dream, but also to behold a new and glorious beginning. We are sitting in this shuttle and waiting for that countdown, full of anticipation, that thrill of expectation, ready to go out there and create an impact. One which would make our parents, our teachers, and each and every one of us filled with unbridled pride. Pride that we have endured hundreds of hours of lectures, years of clinical rotations, and countless sleepless nights. Finally, we will be fully engaged in the profession of our choice. If I were to select any one of you sitting here today and ask you to recount what stands out to you the most about your time at the University of the West Indies, not one of you will tell me about that detestable exam you had to write in year 2, or that course in year 3 that you fervently wished was not a component of your degree. We wrote those examinations. We worked our way through the courses, but the everlasting impressions that will forever color our minds are our interactions, our daily rituals, our faculty traditions. Who could explain that strange yearly ritual of Mount Hope students sitting in the aisles of Amity, dressed up in fine Bollywood style, watching our Trini Shah Rukh Khan act out what you could swear was the exact fight scene in the last Jet Li movie? Who could explain the magical lure of the blue thing by the foyer, and why the whole of Medsai has to line there before class, after class, and during the water break in between class too? We will always remember the various student organizations such as MEDS, MHIS, IVCF, MSSC, DSA, VSAT, and TOPS. The events hosted by these organizations were always something we looked forward to, and the endeavors these groups made on behalf of the students are indeed something to be applauded. Looking back over the years, you will realize that the success which we celebrate today was not achieved without the contribution, guidance, and assistance of those who must never be forgotten. Firstly, all thanks be to God, who guides us and protects us, and who carried us through our various challenges. I'm sure many of the parents sitting here today feel as though they themselves are receiving a medical degree, because they were just as committed and dedicated to seeing us through our journey as we ourselves have been. Our families made sure that we were comfortable at all times. They sacrificed so that we could have the time and resources that we needed to reach where we are today. On behalf of all the graduates, I sincerely thank you. We owe many praises to our university and its entire administrative staff for being that vessel that took us on our journey to excellence. We attended a university that promotes diversity, not just from the Caribbean, but the world over. We were world travelers, all from one focal point of the St. Augustine campus. My fellow graduates, do you realize how privileged we are to graduate on the auspicious half-century anniversary of our beloved university. In this month of October, the University of the West Indies has celebrated its 50th anniversary and is still celebrating the achievements of us all, this class of 2010. To our erudite lecturers, we thank you for your unremitting devotion to us. You were more than just imparters of knowledge and skill. You were mentors to us. You encouraged us. You humored us at times. And most of all, you challenged us. We hope we will continue to make you proud. University gives us a gift apart from our education. It blesses us with friendships, many of which we will maintain throughout our lives. At the Mount Hope Faculty of Medical Sciences, we function as more than just friends. We have become family. There have been so many moments of fun through the hard work. Going Maracas for bacon shack, gathering at our Ruby Tuesday watering hole, being the Trinidad record holders for longest subway line ever, and of course the impromptu cricket and football matches. Even though we move on in varied directions, the bonds we have will never be broken. All of us here today should understand the value of the seat that we sit in. The certificate inscribed with our name with which we were presented. We are heirs of a great legacy. Today, we take up the mantle of responsibility that comes with being a medical professional. We are in one of the most essential professions ever created. We are in a profession that is centered on improvement, a profession that consistently seeks the elevation of mankind and animal alike. My colleagues, we are in a noble field, and we have every right to be proud of where we are and who we have become. That pride does not come without considerable responsibility, however. We have a duty to uphold the highest standards and to ensure that every single action of ours is geared toward the best possible interest of the patient. I'm sure many of us will miss seeing our dear Dr. Nayak running around Mount Hope on evenings, enthusiastically waving to everyone he passes. I don't know if you realize this, but Dr. Nayak was still teaching us, even outside the classroom. He was teaching us the value of taking care of ourselves. Even though we have hectic jobs, we must be able to practice what we preach to our patients. If only we could have his kind of enormous energy and discipline as we approach our careers, we will be well on our way to success. I have been working now for 3 short months. I see people come in every day, distraught with their pain or their children's pain. And even after having sought medical advice, they still feel as though there is nowhere to turn. They still feel dissatisfied. These are the people who have interacted with every one of us, and my colleagues, they have expectations. People want us to listen. People want us to pay attention to them, to treat them as priority. We are professionals, and we must accept the responsibilities that come with the path that we have chosen. Do you remember that essay we wrote for communication skills in year 1? As you will recall, we had to write an essay about why we chose to pursue our particular profession. How did you answer this question? Something in you must have made you want to do this. Each of you would have indicated somewhere in there the impulse, the desire to help people, to care for people, to ease their burdens and their suffering. Our hearts and heads must be in the same place. We could never reach the pinnacle of our profession if we do not have this balance of heart and mind operating in fluid fashion. We must cultivate compassion and empathy within ourselves and endeavor to maintain these virtues throughout our lives. For far too often, the trials of daily routines make us immune to human suffering. We are all members of what I like to call the compassion sector. We care, yes, But what exactly does it mean to care? We have to elevate our caring to a higher level. And how do we do this? We have to do this through our creativity, finding creative solutions to problems. We have spent 5 years equipping ourselves with knowledge so that we can care intelligently. One of my professors, Professor Pillai, said to our class, "You are worth your knowledge." I am taking liberties here, but I would like to expand that and say, it is not only what we know, but it is how we use what we know. The father of medicine, Hippocrates, reminds us that it is far more important to know what person the disease has than what disease the person has. We will not treat diabetes, no, but we will treat Mr. Harrison, the farmer, the diabetic patient. We, the doctors, dentists, veterinarians, pharmacists, physical therapists, nurses, we are links in a chain of caring. Let us join the ends of this chain so we have a circle of care around our patients. Newton D. Baker once said, "The man who graduates today and stops learning tomorrow is uneducated the day after." End quote. We will be in a dynamic learning environment for the rest of our lives. We should never cease to be lobbyists, always fighting for better patient care management, always fighting for the implementation of newer medical technologies and the inclusion of novel drugs in the formulary. After having interacted with so many of you over the past 4 years, I can say with confidence and optimism that we have what it takes to change our environment. In all the specialties, dentistry, MBBS, pharmacy, veterinary medicine, nursing, physical therapy, I have seen the makings of greatness. I have seen brilliance and worked alongside it. I have seen your passion and involvement in the affairs around you. I now look forward to seeing you touch the lives of people in a profound way. As we walk out the doors of this hall, as we cross that threshold for the first time as university graduates, let us take a deep breath and feel that change within us. I leave you with the words of Tom Brokaw. You are educated. Your certification is in your degree. You may think of it as your ticket to the good life. Let me ask you to think of it as an alternative. Think of it as your ticket to change the world. I wish you the best of luck and hope that you will have a rewarding career. My fellow graduates, I am honored to tell you, it's been a pleasure. Congratulations. Give yourselves a round of applause. Thank you, and may God bless you.